Hi students, are you still wondering what are the important topics for your NEET MDS exam? Then just watch this video. It has all the list of topics from the previous year question papers allocated to specific tasks in the Meriters app. So you will find out the weightage of all specific topics in each subject in this video. The anatomy of permanent dentition has maximum number of questions, so it's the most important topic when it comes to dental anatomy. You must never miss that topic. Now it's a huge topic, I know. When you talk of anatomy of permanent teeth, it could be from incisors to molars, but the best way to remember is to solve many questions, to solve all the tasks. And the questions may also appear from less popular topics like calcification and eruption of teeth shows only one question asked in the past 6 years, but that doesn't mean that the topic is less important. You should definitely do all the tasks. So as you can see on the left side, there is a lot of questions that appear from development of tooth and salivary gland, and then questions from pulp, dentine and enamel are almost the same. No questions from cementum. Now that doesn't mean that you will neglect cementum, because you may have questions in perio. So based on how it is placed or based on the kind of application that they are asking. So you must focus on tooth development, salivary glands and the four major structures, that is dentine, enamel, pulp and OMM. So these should be your priority when you are preparing for dental histology, but at the same time make sure that you are not completely neglecting the other topics, because they have the potential to be asked in the subsequent exam. And over the years we've also seen that most of these exams, sometimes they will focus only on one set of tissues. Like you'll see a lot of questions on OMM in one exam, some exam you'll see a lot of questions on enamel. So it's likely that they may not be very evenly distributed amongst all the topics. So keep yourself prepared for that. Most questions have appeared from implants. So implants are very important in perio. You will find a lot of implants on prosthetics in prostho. So make sure your preparation with implants is optimum. Now that is one topic that you have not prepared thoroughly as an undergrad student, and it is understood. But we have enough data within the app that is just enough for you to know everything about implants for the exam. So make sure that you are preparing implants from perio and prostho and solving all the questions on them. Talking of primary perio topics, so a lot of questions from plaque and microorganisms, a lot of questions from instruments and surgery, and lesser questions from plaque control, pockets, TFO, but that doesn't mean you are going to neglect these topics. Now this is an easier approach once you know which topics to focus on. And as you can see that bacteriology has nearly 19 questions out of a total 49, right? So that's a huge number. It's like 1/3 of your microbiology questions will be from bacteriology, and your main focus should be on these questions, followed by sterilization and myco and parasito, and lesser towards culture media and complement pathway. But that doesn't mean that they are not important. So you must focus on all of these topics, but more so on bacteriology and sterilization. Maximum number of these questions are from hemodynamics and hemostasis. So edema and thrombosis are two important chapters to read. Then secondly, you see anemia, WBC and platelet disorders. The count may be a little lower here because they are very direct patho-based questions, but applied questions in oral path are extensive. So your preparation on path and oral path should go hand in hand. And then inflammatory mediators that you see here are also parallel. You'll see a lot of mediator related questions in perio, so that's important. And general aspects of neoplasia, now that also corresponds to neoplastic cell features and dysplasia in oral path. So it's basically path is a mix and match of a lot of subjects together, and to be able to understand path correctly, focus on the original path questions with regards to hemodynamics, hemostasis and staining and everything. Now as far as amyloidosis, apoptosis, cell injury, all these questions, all these topics are considered, they are more or less fitting in some other chapters. That's why the assignment here is not reflecting very well on these topics, but that doesn't mean you will neglect those topics. This is pretty surprising that salivary gland tumors and pathologies, which is such a small topic, had so many questions in the past NEET MDS exams. So this one topic is definitely important. Syndromes is difficult as a topic because there are too many syndromes and too much information, right from their etiopathogenesis, their genetics, to remember each of their features, to remember how to identify based on clinical presentation. But one very peculiar thing that can help you with syndromes is look at the MCQ videos when you are preparing, because there are so many images which are included in these videos that you will have a pictorial memory of all different kind of photographs that are picked from different sources. So syndromes have to be prepared very well with videos. Okay, so MCQ videos, when they are attached, make sure you watch them. Then other questions on bone and joints and cysts and tumors are also very popular. There is nothing that you can possibly leave in OPATH, but I really want to highlight the fact that repeated questions have appeared in forensic odontology over the past few years, and that is one topic that you've not really focused as undergrad. So you must revise that, like pay more attention to forensic odontology, because it's less information and more weightage. Then bacterial, fungal and viral infections, very easy and parallel to microbiology, so it will always get covered here or there. Pulp and periapical infections will also get covered elsewhere in endo, so you don't need to really worry about that so much. Caries surprisingly is less here because we've covered more of caries in pedo and restorative, so you can always expect the overlap. And overall developmental disturbances is important. You cannot skip that. Look at all the images, the x-rays. Now, another way of tackling a lot of these anomalies is to look at the radiographic appearances. So we have a lot of radiographic diagnosis related questions in oral radiology. Make sure you are watching that video and the strategy and the related questions and content with regards to oral radiology. So as you look at the summary of the topics, radiographic diagnosis has maximum questions, but like I said, there will be a lot of more such questions in oral path. So keeping that aside, more questions are seen on intraoral radiographs and projection geometry, and a lot on artifacts, followed by extraoral radiography, and much lesser on physics and radiation. So this should be how you tackle the subject. And we see that a lot of questions appear firstly from thorax and abdomen, from embryology, and all the structures in and around the mouth. So larynx, pharynx, trigeminal facial nerve, and nerve supply of head and neck, and arterial supply of head and neck. So everything around the face is important, everything around the mouth is important, and embryology, the development, pharyngeal pouches, and the initial part of development is all very important. And as you can see, swellings and ulcers and tumors are most commonly asked, followed by cleft lip and palate, venous disease, arterial and venous, and thyroid. Surprisingly, 10-12 questions from thyroid, which is a relatively smaller topic. So your focus here should be on these swellings, especially thyroid and all the other swellings in the head, neck, face. And that also means that lesser questions have been asked on burns, head injury, fractures and dislocation, diseases of larynx and pharynx. But do not neglect them, because you can always have newer questions from these less popular topics. As you can see, Exodontia is the most commonly asked question for sure. I would also consider impaction as form of Exodontia. So nearly 20 questions out of 75 are from extraction, and 12 questions on local anesthesia. So if you focus mainly on extraction related procedures itself, you are covering more than half the possible weightage for oral surgery. And then the other parts, that is fractures of the middle third, condylar fractures, sinus, odontogenic infections, they are all equally important, right? So your second priority should be these topics. And lastly, you have lesser questions from mandibular fractures, from cyst and tumors, not so many, prosthetic orthognathic surgeries, Specifically orthognathic surgeries, not so many questions like BSSO and all. But that doesn't mean that you will completely ignore these topics. They can always come up in the new exam, in the next exam, because there is always a tendency of some surprise questions in subsequent exams. And oral surgery is a very good subject to have surprising questions from. Focus on medical emergencies equally, they are very important, and you will see a lot of these questions repeat from time to time. So you will see a lot of medical emergency based question in medicine, in surgery, in oral path, somewhere in perio, wherever a little surgical procedure is involved. Now with this information in our hand, that is, we know the topics which are important. CNS, GIT, endocrine, cardiovascular and neuromuscular are very popular in terms of expecting questions in NEET MDS. But as you can see, more or less you have questions from most of these. And lastly here, anemia, lung volumes and capacities. All these questions are some or the other way covered in medicine, in path. So they are also asked. That's why they are not showing very well here. But what is the take home message from this is that all systems are important with regards to physiology. But all of these questions are very simple and factual. There is not too much of case-based questions or not very complex questions from physiology. So I think it is an easy subject if you can remember all these facts very well, especially GIT and regulation of blood pressure, cardiac cycle, respiratory cycle, the whole countercurrent mechanism in kidney. These are some very important concepts that you can always, revise and expect in the exams. So blood and endocrinal drugs is 15 questions. So blood say 7 and endocrine 7. Then followed by CNS and ANS. So nervous system, the sympathomimetic, parasympathomimetic and likewise. So all of these are most important in pharmac. Followed by antibiotics. So antibiotics we have divided into 4 categories here. That's why they look spread out. But antibiotics are very important in pharmac. Then you have local anesthetics and general anesthetics. A lot of these questions you will also find in oral surgery, followed by cardiovascular and NSAIDs. So this is a summary of all the different type of topics to focus on in pharmac. And make sure that you are very well versed with all the classifications, because if you know the mechanism of action and classification of the whole family, if you know the family and if you know the classification, you can apply the laws to all of these drugs on a very large scale. So classifications are very important in pharmac. Infections are the most popular topic, is the most popular topic for questions in medicine, and they are relatively easy to master. So your focus on infection should be 100%. And then each system, so GI is 10, neural is 9, then cardiac is 8 and 5, so that's 13. So cardiac is important. Then blood is 8 and 6, 14. So nearly 12 to 15 questions in each system have been asked. All of them are important. You can't say one is less important than the other. But as you see, diabetes mellitus in itself is one small topic and there are 4 questions. So there are chances of getting good questions from diabetes mellitus. And more or less all systems, like I said from the beginning, are equally important. Your focus should be on the systems that you are comfortable first. Do them first and then move on to. So physical and mechanical properties, 9 questions, and other properties 5 questions. That's a total of 14 questions in 6 exams. So 2 questions per exam come from mechanical properties. A lot of questions on gypsum products and impression materials. Then we have casting and casting alloys, and lesser questions, no questions from amalgam surprisingly, but it's an outdated concept. So material wise, you may not expect a lot of questions. Go through the basics, of course. You will expect a lot of clinical questions in operative dentistry. So make sure that you are doing that correctly. And polymers also, a few questions here and there. More on self-cure, heat cure differences and their properties. As you can see, we have 17 questions from maxillofacial and implant. Who would have known? This is one of the topics that are really upcoming. You will see a lot of questions coming up in all INI-CET AIMS exams also. So do not neglect maxillofacial and implant prosthesis. It is not much to cover. It is all basics only. watch videos, look at all the data that's there, cover implants in perio and prostho both. The surgical aspect is covered in perio, the prosthetic aspect is in prostho. So make sure that you are well versed with implants and maxillofacial restorations, prosthesis. Then as you look forward, special considerations in complete denture and principles of tooth preparation are most important, and less important are very factual questions. Here you see a lot of clinical questions, a lot of relevant case-based questions with images. So make sure your focus areas is divided amongst all the topics equally, because you can expect a mix of everything in the exam. Now, like I said before, there's a lot of dental material overlap with Prostho too. So make sure that you are also looking at dental material as an integrated subject with Prostho, where maximum questions in cons are asked from principles of cavity preparation and then followed by the other topics. So the other topics are more or less the same level of importance, but your primary focus in conservative dentistry should be on principles of cavity preparation followed by the other topics. Now, whenever I say other topics are not so important, it is only based on the recall from previous years. You can always expect newer questions from any of these topics. With regards to endo, it's fair to say that all questions, all topics are more or less important, because pulp and periapical pathologies, if you club them, they sum up to the same 6 to 7 number of average questions in the past exams. And then instruments and materials are important, trauma is important, diagnosis is important, access cavity is important. So endo has limited number of topics, but they are all important. And there have been lesser questions, or rather no questions, from surgical endodontics and post-end core over the last few years. So it is relatively not as important, but that doesn't mean that you are going to completely neglect those topics. If you have the opportunity to practice, definitely go for it, because you can always expect surprises in your exam. But definitely focus on what's showing as a highlighted area in these topics. And as you can see, vitamins is like the most popular topic where you'll expect a lot of questions, followed by nucleoproteins and enzymes, and then metabolism of carbohydrates, lipids, and proteins is something that follows. Now, based on this, we can see that you must focus on these questions, on these topics for sure, but that doesn't mean you are going to miss out on the not so popular topics, because you can still expect fresh questions and new questions from them. But the idea is to understand which are the hot favorite topics. We've gone through all the questions from the past NEET MDS exam, and what we see is a lot of questions appear from preventive dentistry, levels of prevention and basic preventive techniques like pit and fissure sealants, atraumatic restorative technique. And then biostatistics together, all three of them have 23 questions out of 89. That's a big number, and you should focus a lot on biostatistics. It should be rather your priority when you're preparing for this. We can say that caries and restoration is very commonly asked, so that's a task that you must focus on, and so is pediatric endodontics and behavior management. So the tasks which are showing more number of questions are definitely important, but that does not mean that the tasks which are not showing many questions are less important. You can always expect new questions from these tasks, and it is necessary to maintain the balance. So we realize that we have a lot of questions from preventive and interceptive orthodontics, fixed appliances and model analysis, followed by all the appliances, growth and orthopedic appliances. So this gives us a fair idea as to what should be your focus area when you are preparing for orthodontics. Now, the questions, lesser questions from topics towards the end does not mean that they are not important, but you must certainly focus more on these topics which have more number of recall questions. Now that you know all the topics that are necessary to know for your NEET MDS exam, and if you've not enrolled with the Meriters app, you still have a chance to prepare and upscale your preparation with the Meriters Crash Prep Pack. This pack allows you access to all the tests and the content, video and questions to prepare for NEET MDS 2025 exam. And this will really help you boost up your score. So what are you waiting for? If you've not signed up, check out the link in the captions below.